Hi, this is a short lecture on coronary circulation. It wasn't originally in the lecture series for Module 2, but it's an important piece, so I added this lecture. So we'll go ahead and get started. And again, this is on coronary circulation. So just to start out, to kind of get you oriented, this slide is showing sort of a schematic diagram of blood flow, three variations on this. So a schematic just means it's sort of a flow chart. It's a sketch. It's a scheme of how blood flows. So when I'm talking about a schematic, it's just sort of a diagram, a flow chart. So there are three, and two of them I have sort of faded out because we're not talking about those. But I think you can still read the text. One of these, the first one perhaps, is the systemic circulation. And that's pretty much everywhere that we're talking about except the heart, which we will talk about, and the digestive system, which we'll talk about later. So that's the systemic. So when we talk about blood flow to the arms, to the legs, to the head, that's all systemic blood flow. Systemic means system-wide. So it's going out to the whole circulatory system with a few exceptions. The heart and the digestive system are a little bit different. So that's the schematic, that's the systemic blood flow. And we can do some more with that. And then there is the digestive blood flow. That's a little bit unique in that it involves a venous portal system that we'll talk about. So those two boxes are sort of faded out. Here's the systemic, and the digestive is over here. And we will be talking about the coronary circulation in the middle. So the basic flow of this schematic is, you should already be familiar with some of this. The blood leaves the left ventricle. It's gone through the right side of the heart. It's gone through the lungs. It's come back to the left atrium. It's now down in the left ventricle, ready to be ejected out through the aortic semilunar valve. So it flows from the left ventricle into the aorta, and then from the aorta it goes into the coronary arteries. That's what we're talking about in this lecture. And those coronary arteries then perfuse the myocardium. So this is perfusion, which is what all oxygenated blood needs to do. It needs to perfuse the tissue. And in this case, we're perfusing the muscle itself, the myocardium. And the basic plan that we've already gone over is that arteries branch and branch and branch until they get down to the tiniest of arteries, and we have arterioles. This is general for all circulation. And then the perfusion, the exchange of blood with the interstitial fluid, occurs at capillaries. So that's true for all three of these circulatory systems. So sticking with the coronary circulation, after the oxygenated blood perfuses the tissue at the capillaries, it drains out through the venules, and then those venules then drain into larger and larger veins. And in the coronary circulation, they are called cardiac veins. So we have coronary arteries, and we have cardiac veins. And those veins then drain into the coronary sinus, which we'll take a look at. Wanted blue for venous blood. Drains into the coronary sinus. It's done its job. It's perfused the heart. It now needs to go back and pick up more oxygen. So it heads back to the right atrium, and you know the circulation from the right atrium. However it gets to the right atrium, the next place it's going is to the right ventricle. After the right ventricle, it's going to the lungs. So that's the basic picture for coronary circulation. There's not a lot of new material here other than perhaps coronary arteries and cardiac veins. And that's what we're going to be looking at in the next series of slides, is this circulatory system for the heart. So let's go to the next slide. And I've tried to organize this and simplify it, I hope. So these are the coronary arteries, and they're paired up with the cardiac veins. And capillaries are in between the two. Okay, so there's 3 sets of arteries and veins that I want you to know. So within the anterior interventricular septum, so you have to get yourself positioned. This is the heart. And if we are looking at the heart, maybe I'll just draw a Valentine heart, something like this. That groove on the surface, which forms the sulcus, is the interventricular sulcus. It's between the ventricles. And it's on the anterior surface and the posterior surface. So that's the typo. Dang. Sulcus, not septum. I'm not going to go back and fix this right now on the slide. So we're just going to make a typo correction. Anterior interventricular sulcus. And the problem with copying and pasting is that if you make an error in one, you make an error in the other. So this also should be sulcus. Shoot. Well, I'll fix that later. Okay. But for the lecture, we're going to run with this slide. So we have an anterior interventricular sulcus, and we have a posterior interventricular sulcus. So on the anterior surface, in that sulcus, is the anterior interventricular artery. That's what it's called. And we'll take a look at it. That's sometimes referred to also as the left anterior descending. You need to know both. Anterior interventricular artery is clear. You know it's on the anterior surface, large artery running down the sulcus between the 2 ventricles. The left anterior descending I like for a number of reasons, one of which it tells you that it's a branch of the left coronary artery, which the other term doesn't. It's on the anterior surface, okay, and it's descending. So it's going down. And that is easily abbreviated to LAD. And I want you to know the LAD. It gets bantered around in shop talk, in the ER, in the hospital. They'll probably refer to it as the LAD, simply because it's a lot easier to say than anterior interventricular artery every time you want to mention it. You're talking about the LAD or the LAD. Okay? But I want you to know the different names and that they're the same. Paired next to that, and that's what I've tried to do here, is write these in pairs, is the great cardiac vein. So it's coming up that way. And it too is in the anterior interventricular sulcus. So this is the largest of the 3, great cardiac vein. And we'll abbreviate vein here with a V period. And you can do that also on an exam. And the green was what? I'll just call it the LAD. Again, I would rather do that than spell out anterior interventricular artery. Okay, so that's one pair. Those are the big ones. And then you flip the heart around on the posterior side and you have something similar. So we have the posterior interventricular sulcus between the two ventricles. And within that sulcus is a posterior interventricular artery. So we have the anterior interventricular artery, we have the posterior interventricular artery, and I'm not familiar with a popular abbreviation for that because it's not often, it's not as involved in coronary disease issues perhaps as the LAD. But it's paired with the middle cardiac vein. So if you flip the heart around and you look at it on the posterior side, you have the same arrangement. You have an interventricular artery, and now you have the middle cardiac vein. And I'll show you pictures of those. And then on the right side of the heart, or the right margin of the heart, there is a right marginal artery and a small cardiac vein. So you should make flashcards, whatever it takes, to pair up the artery with the vein. Okay, so let's go through, look at some anatomy pictures. Okay, this slide, I believe you should know everything on it. Maybe we can cross out a few things that you don't need to know. So let's just say no all of this slide. Okay, so here is the left ventricle. So we're oriented. There's the apex. And all of this over here on the other side is the right ventricle, of course. And we're talking about this anterior interventricular sulcus between the two ventricles. You should recognize this is an anterior view. Apex at the bottom, and the giveaway here perhaps is one way of looking at this is the pulmonary trunk coming out of the right side. So the blood is flowing out from the right ventricle into the pulmonary trunk and then again off to the lungs through the pulmonary arteries. Okay, so we're looking at an anterior view. And let me clean up the sulcus that I just drew on. So here is our left coronary artery, and it's in the coronary sulcus, which is the groove between, if you will, between the atria and the ventricles. So if we're looking at a heart like this, there are our four chambers. This would be the coronary sulcus. Right in here. Goes around the heart. Okay, so at any rate, back to the arteries and veins. Here is the left coronary artery. It's coming off of the aorta, which we'll look at later. And major branch is the LAD, which is coming down. It's the artery. It's going right down sulcus. So that is the anterior interventricular artery, as they call it, or the LAD. LAD is also sometimes referred to as the widowmaker, because when that one plugs up, it supplies most of the left ventricle, which is your main pumping chamber. So, the vein that's next to it is the great cardiac vein. So there's the pair running together in that anterior interventricular sulcus. On the right side, coming out of the aorta, and the next slide shows the origin of the cardiac veins, the right and the left, more clearly. But here is the right coronary artery in the coronary sulcus, again, in that groove. And it is going to run around posteriorly, but in this view you can see that it gives off the right marginal artery. It's getting the right side of the heart, the right margin. And these are just the three main ones. Of course, there's all kinds of variation and lots of other smaller arteries and veins. Paired next to the right coronary artery, or let's we should talk about or circle the branch. The right marginal artery is the small cardiac vein. So there's your other pair. So let's take a look at a different figure here. Again, anterior view. Here is the apex of the heart. So this is left ventricle. That makes this right ventricle. That makes this the pulmonary trunk. And this is the aorta, coming right out of the center of the heart. This would make this the superior vena cava, and you can kind of go through and identify some of these others. Okay, so right and left coronary arteries. The fat's been cleared away. It's a more clear drawing, and here is the origin of both. So on the left side, left coronary artery, coming right off of the aorta. And then descending is the anterior interventricular branch, or the left anterior descending, which again you can abbreviate as the LAD. However, if I ask for you to identify that artery on an exam, you need to spell out LAD at least once the first time, so that I know that you know what it stands for. And paired next to that is the great cardiac vein. There's our pair. And that anterior interventricular sulcus. And the right side, the right coronary artery, gives off several branches, one of which is the right marginal branch of the right coronary. And we have the small cardiac vein. So there's another pair that we were looking at. If we flip the heart over on the posterior side, it's a little bit different. The arteries and veins up in this region are different. You have to get yourself oriented on what you're looking at. It's posterior side, so spend a little time working on that. And what we're showing here is the posterior interventricular artery. Now it's flipped around. So this is the right coronary artery. So you're looking at it from the back side, still assuming anatomical position. So this is the right atrium, the right side, and we have the left side on the left. You're looking behind the heart. So here comes the right coronary artery again, wrapping around the heart in that coronary sulcus, and then it branches down typically and produces or gives rise to this this posterior interventricular artery. And paired next to it, running parallel with it, is the middle cardiac vein. And there's your other pair. Keep them together. I think it's easier that way. Okay? Now, all of those veins are going to drain ultimately into the coronary sinus. So all of the blue veins, all of the veins are draining in this direction. And they all pool into this coronary sinus. And you know where the blood flows from there. It goes into the right atrium. Okay, next slide. Again, posterior view of the heart. Get yourself oriented. When you see the sinus, you know you're looking at the posterior side. And here are the different cardiac veins flowing into it. So on the posterior side again, we have the shown is the posterior interventricular branch. And we should have a great cardiac vein, or middle, excuse me, on the other side. But they are paired. Okay, that's probably enough. Again, you should be able to recognize and identify these different blood vessels, just for sort of basic anatomy. Okay, next slide is a picture of the cardiac veins without the coronary arteries next to them. This is an anterior view. So again, you have the apex and the sulcus between the two is more or less here. And the pulmonary trunk, pul trunk, abbreviated, etc. And what they've done in this view is they've shaded what's sort of hidden behind. So the great cardiac vein is, I'm going to get rid of our sulcus. The great cardiac vein is draining blood through the sulcus and around and back into the sinus behind. So the coronary sinus and some of these other, like the middle cardiac vein, some of these other veins are dimmed. They're rather faint because they're trying to show that it's behind the heart. And you could tell me where this is going, where that hole is going. This hole. Okay. So there are the great cardiac vein, the middle cardiac vein, and the small. Next slide. Probably should have done this in different order. Same idea though. This is the coronary artery side, the supply side. So you have the left coronary artery. Again, things that are hidden are dimmed. There's the origin of it. And we have the right coronary artery. And we have the right marginal artery. And here's our anterior interventricular artery, or the LAD. Okay? So perfusion of the heart. And there's lots more we could do with this. When a patient has coronary artery disease and they have to go and put a bypass in, it's usually because there's some sort of blockage perhaps in an artery. They can go in with a stent, and which is a pretty amazing procedure, how you guide a catheter from the leg coming up through the femoral vein, up the inferior vena cava, and actually they'd probably be coming up the aorta and come up and then snake their way with a catheter into the coronary artery, place a stent, or do whatever other sort of magic they do in the catheter lab. Okay, well that's not for this class. And that's it. I hope this is helpful for the basic picture of the coronary circulation, perfusing the heart tissue.